Pediatrics. Dr. Ilham received training in pediatrics and pediatric hematology in many countries, Cairo, Japan, USA, and the UK. She is a certified trainer from the IBCT in Netherlands. Professor Ilham received in 2011 a master's degree in health professional education. In 2012, she completed a 2-year program in Famer, Philadelphia, USA. She has more than 40 publications in scientific journals. Dr. Ilham was a speaker and chairperson in many scientific meetings. Dr. Ilham Youssry, the floor is yours. Please let us know your thoughts about opportunities and challenges in digital health.
Yeah, thank you. Good morning, good evening, good afternoon for everyone based where you are. Thank you so much for inviting me for this meeting that carry a hot needed topic. I think we in need for such topic because the healthcare services facing a lot of challenges nowadays. I think we are growing population all over the world. The skillful physician are limited. We shortage in the skills and the skilled healthcare providers, and definitely the budget and the money of the healthcare is limited all over the countries, and the cost of the service is increasing. So I think we do have a great challenge on the financial support for healthcare. Therefore, if we continue like that, I think healthcare services will face a great collapse in the future, and we should search for a solution to help maintaining good health services to be offered for every population. And I think one of the very proposed solution to overcome these challenges, shortage in healthcare providers, increasing number of population, budget and time and money. I think the only solution is to change the healthcare service like every service around us have been changed. Imagine now if you want to buy something, you will go for Amazon and order it virtually and remotely. If you want to make any bank service, you will go for your internet banking and do what you want to transfer money to buy any financial document and so on. So even if you want to go to watch a film, in the past we used to go to the cinema. Nowadays we just subscribe for Netscape and we can watch whatever film we want. So the changes, we are surrounded by changes in every single service we need. And I think we should extend this for the healthcare. So we should work to raise the awareness of the population and to change their mindset to accept healthcare service is like all the services they ask remotely, like buying things, like watching films, like banking and money transfer. So I think this is one of the very needed point is to spread the awareness among population and among the decision makers to think about offering the healthcare service virtually and remotely by applications. So we should encourage the IT population to manufacture and to create apps that can facilitate the medical performance. Also by creating such apps and by opening what's called the patient portal. The patient can enter in this portal and record every single change in his or her health. And by getting this patient portal, I think we can get a real-time data for the patient illnesses, because all of us who are practicing medicine facing the challenge of getting the decision based on historical data from the patient history. And definitely patient cannot recall too much data. If we open patient portal and the patient automatically entered his or her medical data day after day, we will get what's called real-time data that will enable the physician to take decisions. So I think I will end my talk. We do have great challenges, yes, but we do have a great opportunity in e-healthcare services. It will improve the accessibility. It will be definitely less in time and money. It will give real-time, complete patient data. Definitely, it will be much easier in data analysis and taking the decision. The e-health will facilitate shared care between different specialty. Definitely, it will empower patient, and patient empowerment. He is able to enter at any time, searching, asking, getting answer. Beside all these opportunity, definitely there is a great challenge, like difficulty in the technology, especially for patient technology averse patient and technology averse healthcare provider. Internet connection, like country like mine, the internet connection may be hard in some areas. Maintenance of the equipment and the maintenance of the websites, I think it is a challenge. I will end my talk. Let us ask ourselves how much of the healthcare services can be digitally transferred. I will end my talk by this open question: how much of the healthcare services can be digitally transferred? And thank you so much for opening the chance for improving the healthcare service by such wonderful services, which is the e-health service. Thank you so much.
Thank you, Dr. Ilham, for this inspiring presentation.
Thank you.
Our second panelist is Dr. Haleema Yezdani. She's a general physician and diabetologist with 20 years of experience, 8 years of experience in telemedicine. She has received multiple awards for the same. She is a member of Telemedicine Society of India, committee member of HIMSS Asia Pacific, selected as one of the future 15 global digital health by HIMSS. She is ambassador of Telehealth Medicine Today, Karnataka, India chapter. Now we are going to ask the second panelist, Dr. Haleema Yezdani, for a presentation about opportunities and challenges in digital health.
Thank you so much. Thank you, TMT, for having me over for this discussion. Definitely, opportunities and challenges facing telemedicine, both are vast and quite huge. And to sum it up in a matter of 5 minutes would be a little tough, but definitely I will try to do so. Well, when you're talking about opportunities, it has opened a sea of opportunities both for the doctors as well as patients. There are patients who are basically devoid of good medical care, just due to the fact that the accessibility is a question. There are people who are unable to access good quality doctors, especially in a country like ours, and they definitely they're suffering with their illnesses, and having a proper treatment is a question. Primary health care is also kind of time bound, and the accessibility gets a bit tough in view of their regular jobs and their daily wages. So in this circumstance, telemedicine definitely comes as a boon. There are, of course, in this particular what circumstance, what I would tell you is the challenge is the connectivity, and the challenge is the accessibility of the devices to access telehealth. Apart from that, if that is made available, the time of the patient, the time and the the work of the patient is much more easier, to connect to a doctor, explain the problem, and obtain a prescription and start the treatment immediately. There are people in our country who live by daily wages, and for them, visiting an OPD means a loss of a day's pay. And there are people who really can't afford even that. And in that case, when we are opening out the services to the rural India, and we are providing them with devices to access the doctors across, this is a blessing and an opportunity both for the patient as well as the doctors. Uh, the challenges I told you is important challenges, connectivity and getting the internet connection. But yes, the government is working on this. We have centers all over the place where people can come in a matter of 10, 15 minutes, register themselves and get this evaluated with the doctor who's on the other side of the panel, can be from any part of India. So they have an access to good quality care. When we are talking about the opportunities for doctors, we are in a position now to reach out to patients in need during this pandemic. The very important factor that is actually, kind of doubled up the use of telemedicine is COVID-19 and the way it has happened in India during the second wave. Of course, it is still ongoing, but the trauma is little, kind of under control. The suffering is little less than what it was the previous month. I was volunteering for COVID-19 patients through telemedicine, teletriaging, and treating the patients. Um, Believe me or not, I had calls in the middle of the night. I used to have sleepless nights for almost 15, 20 days during the previous month when there was a peak surge of COVID-19 patients. There have been people who have been crying out endlessly for medical help and do not have the time even to carry the patient across to the nearest emergency. And there are some people who are clueless about what is the next course of action, what they have to do. They have a near and dear one who's suffering with lack of oxygen. They can see the pulse oximeter reading that the oxygen levels are dipping, but they are clueless as to what is the next course of action. There are some people who are stunned and do not know what to do. At this time, telemedicine is a boon. All they have to do is, if they have the number and accessibility, give a call. And of course, we can guide them. We can be, their support system and guide them until they reach the emergency. Though the what things we can do in an emergency in telemedicine are quite minimal, but definitely first aid can be provided. The patient can be secured until he reaches the emergency. This during the pandemic has been one of the best accessible way to treat the patient and to provide support to the patient and the patient's family. And of course, the challenge in this again, if the patient has language barrier or if they have communication issues, then we have trouble in communicating to them. But otherwise, TrustSuite has been the best possible way to get across to a patient in the times of emergency. We were talking about telemedicine for a doctor as a general practitioner. When I started off with telemedicine, say around 8 years ago, in India, there were not proper rules, and we didn't have any proper guidance from the MCI about the way this particular thing has to be practiced. There were colleagues who were questioning me if it is legal. There were colleagues who were even asking me that am I, kind of authorized to practice this? But during this COVID-19 pandemic, MCI has given a very clear set of rules guiding the telemedicine and digital health, which makes it very easy and very, very medico-legally safe for us doctors to practice in India. And this has really come out as a blessing for doctors, who are actually striving hard to help the people in every possible way. And in this way, the burden on the hospitals and the frontline doctors who are actually fighting and struggling with the virus every day, the burden on them has come down considerably, because at this end we are triaging the patients and we are isolating as to who can respond to home isolation and who might require admission. As you know, our healthcare system had crashed during the last month in view of the peak for COVID-19. And during this time, telemedicine has definitely proven to be an opportunity, and it has reduced the burden on the hospitals to a considerable extent. In the non-COVID time, management of chronic patients, chronic illnesses like diabetes, hypertension has become much more easy. The patients need not have to put a leave and go and sit in the OPD waiting for the doctor for one day or half a day, and spend the time thinking that they're getting white coat hypertension, and by the time the patient reaches the doctor's cabin, the BP shoots up. So this basically can be avoided. All they have to do, pick up an application, download it, and give a call across to us. So once we are in the whole of the situation, we can recommend them the management, and it can be carried on further, so on and so forth. This has really proven to be a blessing in management of chronic ailments, reducing the hospital stay, and reducing the hospital visits for immunocompromised patients. The only hindrance which I am thinking now is rural India having the connectivity issues, and there are some patients who have to be educated about the use of telemedicine and digital health. There are patients still who are questioning whether it can be done. There are patients who still are not kind of convinced with the doctor just speaking to them. There are people who say that unless the doctor touches and examines them, they do not have the kind of confidence in the doctor. But this particular education, if done, we can definitely reach milestones with the help of telemedicine and digital health. I think this is a boon either for both of us, for doctors as well as the patients. The patients have to be more educated about this. I believe that the webinars like this can put across our words in a much better way. I end my talk with this, that digital medicine is the way forward. I think we all have to embrace it. Thank you so much.
Yes, thank you, Dr. Haleema. Your presentation was very motivating. Our third panelist is Mr. Nana Frimpong, with a strong profile in driving commodity and service-based social initiatives across Africa, winning him a 2017 Industry Award for Operational Excellence. Nana applies his industry expertise to advance Visita's digital healthcare platform across East and Sub-Saharan Africa. Nana successfully expanded Visita operations to the African continent in 2020, adding Kenyan and Nigerian markets to its footprint during the COVID-19 pandemic. He is now focused on driving Visita's product adoption in the region, in line with Africa's 2030 vision and SDG 3 plan, to advance inclusive healthcare systems across multiple markets through strategic partnerships. Mr. Nana, please, we would like to hear more about opportunities and challenges in digital health in Africa.
Thank you very much, TMT, for this panel. I think it's very needed, especially at this time where we're seeing quite a proliferation of telehealth solutions, teleconsultation solutions, at a critical time when healthcare cannot be delivered in some parts of the world the way it traditionally has been. I'm speaking primarily from an industry perspective, and sort of the two panelists, Dr. Yezdani and Dr. Youssry, have spoken very, very well about opportunities in their parts of the world from the physician's perspective. And so I want to sort of echo some of the things that they've said, and also share my own insights from what we've realized over this year and a half operating in Sub-Saharan Africa primarily. So the first opportunity that comes to mind with telehealth in the region like Sub-Saharan Africa has to do primarily with supply. All right, so in a region which has some of the lowest doctor-patient ratios in the world, if not the lowest, you have a situation where a lot of times doctors in peacetime, so to speak, and during regular period of time are inundated with patients. And sort of that being maybe the best case scenario. In worst case scenario, you have situations where patients just can't access healthcare due to the dearth of doctors. So with telehealth and teleconsultations, you now have an opportunity to leverage within the same continent opportunities in what I consider as doctor-rich countries like Egypt, where you have a significant population of very well-qualified doctors at financial rates that are significantly more affordable than in their Sub-Saharan regional counterparts. So, for example, I can see a doctor specialist in Kenya for about $30 per consultation, and see probably a more qualified Egyptian specialist at about half the price in Cairo, right? And so now you're opening up an opportunity where individuals who previously did not have access to good quality healthcare and can do so without having to get on a plane and fly all the way out to Egypt to do that. The country that I live in currently and work for Visita in Lagos, Nigeria, spends about $1 billion in private outflows, private capital outflows of individuals seeking medical care, spending about $1 billion on medical tourism, and in some cases unnecessarily so, right? And so telemedicine presents an opportunity where you can at least have some triage opportunities, identify who needs to actually travel to a particular country to get health versus who could just, get that health through a simple consultation or a second opinion reading that could end up saving their lives. The other piece that I think is really important here is on the consumer side. Dr. Yezdani mentioned something incredibly critical, which is the fact that a lot of people actually live day to day in terms of their wage earning capacities. And so for such people, a day spent in the waiting room for a physician is a day where they might literally not eat, right? And so finding ways to bring healthcare to them in ways that do not necessarily constrain their ability to feed their families in situations where they're already in crisis is incredibly important. And telehealth offers an opportunity to do this. The other piece that I think is incredibly important for us now is looking at things that were previously not possible, diagnostics, other things that were previously sort of restricted to individuals or oversubscribed, therefore making people a little less, or should I just say just reluctant to pursue these things because of the time spent. In areas like chronic disease management, et cetera, we're seeing significant uptake in these areas, as well as opportunities for improved adherence and compliance to sort of prescription regimes, et cetera. On the challenges side for sub-Saharan Africa, I think the biggest piece is one that Dr. Yezdani adhered to or alluded to, which was the issue of adoption, right? And so quite a number of people still believe that until and unless a doctor has applied that stethoscope to my chest or to my back, I have not been seen by a doctor, or the care provided may not be at the same standard. And so really educating the populations to understand that, the power and scope and reach of telemedicine, clearly identifying for these populations instances where telemedicine proves to be a very effective purveyor of healing and of consultations will be critical to ensuring that we actually realize the full potential of these technologies that are emerging. The other piece, I think, is also educating our doctors to understand the fact that this is an opportunity to expand the pool of patients that are able to access their services, and consequently, in a way that is not very capital intensive in some cases or in most cases. And so consequently, they need to look at reducing pricing a bit to facilitate additional access for these patients. I'm seeing instances within the sub-Saharan African market where doctors are actually opting to charge more for teleconsultations because of the convenience factor, citing that it's a premium that patients need to pay for. And I think that is just the completely opposite way to look at this intervention and the potential that it holds to transform lives. My final point on the challenges is around infrastructure. And I think that Dr. Yezdani alluded to this, Dr. Youssry also alluded to this. Across Africa, this is going to be a challenge both in the urban and peri-urban and rural areas. As I was talking, I think you saw my room go dark. My power went out. And then subsequently, I'm now running on a generator. And not everybody has the ability to do this. And in fact, most people don't even have access to power, let alone the internet. And so finding ways that take advantage or are sort of contextually specific to allowing people to deploy technology that will bring them some of these solutions are important. I'm thinking about short codes, USSD, SMS, just your regular analog phone conversations, or establishing centers that are powered by generators and have stable internet that people can go to, like Dr. Yezdani alluded to in India, that would expand greatly the reach that individuals could have as far as medication and telemedicine consultations are concerned in these countries. And so with that, I just want to say that I think while COVID has wrought quite a bit of havoc in our society, at least in this region, the lockdowns opened up the opportunity for people to consider telehealth as an option. They have now tasted this as a solution that could potentially work. Quite a few people think it's going to be a great idea, and I think we mustn't let up in pushing this particular agenda as a solution that could change lives and dramatically change the healthcare system. So with that, I thank you for your time and your attention, and I look forward to continuing the conversation.
Yes, thank you, Mr. Nana, for this very interesting presentation about digital health challenges in Africa. All your presentations are invaluable, and I'm sure participants have learned a lot from them. Now we are going to dive into more details in our discussion. I would like to go on with the first question to all of you, which is, what are some of the major pinpoints in healthcare that telemedicine and digital health can address? If you can share your thoughts.
Sorry, could I get the question again, please?
Yes, of course. What are some of the major pinpoints in healthcare that telemedicine and digital health can address?
As I told you, early diagnosis can be done through telemedicine. As in, the patient doesn't have to wait for hours together or days together before he gets the appointment of the doctor. It can just, if the patient has a fever today and still continues to have the fever tonight, then early morning tomorrow he can start with consulting a doctor, as well as getting the tests and evaluation done at the earliest. So early diagnosis is one of the pinpoint which can be achieved through telemedicine. And the second thing is getting off your anxiety. If you have a report with you in hand and you get the report at the V hours of the day and you don't have anyone to discuss it with you, and the doctor is available after maybe a span of 5 or 6 days, this would actually kill a patient, having the report and not knowing what is in that. So I think it makes it much easier to contact the doctor across the phone, get the appointment immediately and discuss the reports, and be rest assured about the next management. So these are the important things: array the anxiety and get an early diagnosis.
Thank you for the question. For me, I think the e-health for checkup and screening, it may work. For follow-up visits, when the patient already attended for the first time, we can make the follow-up visits virtually and using the technology. Also, monitoring the response to treatment, I think we can make this over the remotely. Definitely, I echo what's already stated by Dr. by Dr. Naama. We can use for investigation, for interpreting the investigation, for discussing the result of the investigation with the patient. Thank you.
So in my sort of markets, I think specific pain points that teleconsultation has addressed is just basically access, right? So I think of instances where parents could lose a child because they just have to sit and go to the hospital or a public hospital and wait for several hours in the event of even an emergency. And so the early diagnosis that Dr. Yezdani mentioned is critical. As far as life-saving interventions are concerned, where you can use it as a way to just triage patients, help make sort of the consultation pieces a little bit more efficient, so that you're not having rooms that are choked full of people that have a headache versus people that are experiencing a very severe medical event. I also think, at least from our experience, there are pieces like e-pharmacy, which Visita as a company has launched in Egypt. They're looking to launch in sub-Saharan Africa, and appending things like telehealth to that, can help a lot with avoiding misdiagnoses and sort of changing certain behaviors that we are prevalent in this part of the world. So when a lot of people are not feeling very well, the first thing they do is they go to a local pharmacy, right? And then who knows who they meet at a local pharmacy? It could be a farm tech, it could be a pharmacist, it could also just be a person who's been hired just to man the till. Then right there, they're getting some sort of diagnosis. They're going to be sold something that they're going to take, which may hopefully at best be benign and not do anything to help or hurt. At worst, could hurt and create complications on the line, which would not be would lead to a probably more expensive and potentially negative outcome for the patient. And so in instances where you're able to give people the option of easily consulting with a doctor via telehealth, as opposed to feeling like they have to now go and speak to a pharmacist, you've eliminated the possibility of misdiagnosis in the event that they didn't meet a pharmacist when they showed up at that local neighborhood or community clinic. And improve the odds that they're going to probably receive a good diagnosis, or at least be guided on what to do next, which could end up saving their life. So those are just sort of the, in addition to the points that our fellow panelists made, that I'd like to add on as far as the pain points that are addressed by telehealth are concerned. Thank you.
Yes, thank you all for your kind answers. And now I'm going to go ahead to our second question. What are some of the major opportunities for telemedicine in the post-pandemic era?
So I'll take this one as a start. For us at Visita, one of the things that we're looking at is, how do we take the distribution of doctors across the continent, where if you go to North Africa, you have a very, very well-established cadre of doctors across multiple specialties. And the further south you go, excluding maybe South Africa and certain parts of Southern Africa, you have less of that equal, even, and some would say just an embarrassment of riches as far as doctors are concerned, right? And so we're looking, for example, at what policies we can affect within specific countries to allow for licensed doctors that we know are of amazing quality in Egypt and in some other parts of the region, to be able to provide very specific support in areas where you have very, very low supply of doctors. So hepatology, sort of rare diseases, renal failure, etc., to supplement doctor supply in these areas. And then if, for example, there's an in-person consultation required, this individual can now know that they're going to go see a doctor in Egypt or in Morocco or wherever that they've spoken to before, number one, that they're assured of the quality of the doctor that they're going to go see, number two, and that the outcome for them is not as risky or uncertain as it would have been where they were just sort of flying into the dark, hopefully to see some hospital they saw on the internet that they're not sure of, that may or may not be a legitimate entity that could actually provide them with a solution. So I think on my end, that's one massive opportunity that we are exploring at Visita, and hoping to make a reality in the coming months.
Thank you. For me, I think COVID-19 era fastened the process. I have read a quote, sorry, I can't remember the name of the person who stated the quote, but the quote is very impressive for me. We have been pregnant for years and years about e-health. COVID-19 delivered the process by C-section, fastened the process by C-section. Yes, I feel it like that. COVID-19 fastened the process, opened opportunity for people because there is no other chance for them except this way, because hospital closed, clinic closed. So I think COVID-19 fastened and hastened the process of e-health, and we should recap on that, and we should move faster after the COVID era. Thank you.
Yeah, if you're talking about the post-COVID time and telemedicine, we can use it in multiple ways. The first thing would be, as I told you, managing the chronic ailments like diabetes, hypertension, keeping it under check, and getting the people who are on blood thinners to be having a constant follow-up with the doctors who are on telemedicine platform. We can use it for women health. I mean, getting people to educate people about women's health and the importance of women's health, as well as acute problems like getting early diagnosis, as I told you earlier, not only for COVID, even for other ailments, getting the doctor at the first sight as soon as the problem starts. And dermatology problems can be solved at a greater extent in telemedicine, wherein one video call and a proper imaging of the lesion can do wonders for the patient and initiate the treatment at the early basis. So all these ways, telemedicine can be useful post-COVID also. And I always urge doctors as well as patients to continue using telemedicine as a mode of communication and to continue to follow up with the patient, as well as the first assessment also can be done through a video call. Only aspect missing would be the palpation of the lesion or the palpation of the patient. Apart from that, we have instruments like digital stethoscope, which can actually even ease out the auscultating process of the patient. So telemedicine post-COVID also has a long way to go. Thank you.
Thank you everyone for your answers. Indeed, COVID has changed our mindset and approach to healthcare. Your answers brought light to some of the health solutions for overcoming emergency and pandemic challenges. Moving on to our next question. What will be the role of telemedicine in the post-pandemic era? Can you name a telemedicine trend you expect?
I think we answered this question. I think Dr. Haleema have just answered this question. Yeah, and she stated all the services that can be involved under this. So I echo her answer, and I think this question have been answered now by Dr. Haleema. Thank you.
One of the pieces I want to also add, in addition to Dr. Haleema's answer, is I am seeing now a lot of applications that are emerging to support diagnostics. And so, for example, there's one that is looking now at, it has probably one of the largest databases of coughs in the world. And what they're trying to do is they're trying to make it such that in my phone, based on my cough, the physician, if I have that app on and I cough and that app is able to detect whatever it is that I have, matched with millions of other types of coughs and narrow down potentially what could be wrong with me. And so that the physician comes to the table with at least a set of options that they can investigate immediately to then lead to faster diagnosis. So that's just one other thing I want to add. I think that Dr. Haleema has given a very sort of comprehensive response on that particular front, but just thought that this might be another thing to just highlight as an emerging trend. Our cell phones may end up becoming first-line diagnostic tools.
For me as hematologist, thank you so much, Mr. Nan. For me as hematologist, sometimes there is bleeding in the musculoskeletal system, and nowadays there is a program on our phone with sensors. The patient can put sensors in his muscles and move, and it will draw the area of illness and where is the mobility affected in area more than the other. And this will help the physiotherapist even to plan for any physiotherapy session. So I think the advances in musculoskeletal system assessment, even remotely by moving the telephone and by using sensors, I think was very impressive for me. Thank you.
Yes, thank you very much for all your answers. Thank you, Dr. Ilham, Youssry, Dr. Haleema Yezdani, and Mr. Nana Frimpong for sharing your expertise with the audience. It has been really helpful. And I would like to move on to the plenary session with the topic Innovations in Digital Health. And I'd like to ask Dr. Neshat to present the coming guest speaker.